The bee stinger has developed over time from what was once its ovipositor, its egg-laying tube. In all but one species, the honeybee stinger is barbed to hook and remain in the victim and to keep pumping venom. As the bee flies away, the insect's abdomen tears and the bee soon dies. Sometimes its victim dies too, especially if many bees have stung it. Stingless bee. When workers near their hive sense danger, the bees give off an alarm pheromone, a chemical signal they can detect. This alerts all the hive's inhabitants, and they become ready to attack if necessary. If any of them do strike, the glands responsible for producing the alarm pheromone detach along with the stinger and keep giving off the signal to attack. Bee stings are painful for a reason. American entomologist Justin O. Schmidt feels that pain is responsible for the insect's survival. The pain of the sting fools a predator into thinking that the bee has caused more serious damage than it actually has, and thus the victim will avoid it in the future. It's certainly true that although it hurts a lot, the venom from a single sting is not strong enough to kill most animals, including humans, unless you are allergic to the venom. Some sources say that as many as 4 people in 1,000 have systemic reactions to bee stings. When allergic people are stung, they can go into anaphylactic shock. Their whole bodies react so badly that they may stop breathing. To survive, they need an epinephrine shot, followed by a trip to the doctor or emergency room. There are kits with epinephrine syringes available for people with this allergy. The high number of allergic people, plus the fact that bees and humans are common neighbors, explains why these insects are dangerous. Be healthy. Apitherapy. Apitherapy is the use of natural products from bees, including pollen, honey, and venom, to cure a wide range of disorders. Bee venom has at least 40 different ingredients. The main one is melatonin, which is responsible for the ouch in a bee sting. It is also a powerful anti-inflammatory agent. For centuries, apotherapists have treated arthritis and other inflammations of the joints by allowing bees to sting patients on certain points of their bodies. Today, live beads are still used, but some practitioners prefer venom-filled syringes instead. There have been few documented scientific studies, but many patients claim that the venom helps them. Currently, melatonin is being investigated as a treatment for multiple sclerosis, and for cancer, among other diseases. Queen bee. Bees for breakfast. What kind of crazy bird eats bees? A bee eater, of course. These brightly colored residents found in Africa, Asia, and Australia, and southern Europe pursue many kinds of flying insects, but honeybees are their favorites. They catch the bees, take them to a perch, and remove their stingers by pounding and rubbing the insects against a hard surface. A bee eater isn't interested in a sitting bee or other bug, even if that insect lands right next to it. These birds will only hunt things on the wing. Bee eater.